All right. Welcome, everyone. Good afternoon. It is so nice to have you all join us on this light-filled afternoon. I'm really grateful to bring to you this third installment of the Black at Hostos Town Hall series at Hostos Community College. My name is Diana Kramer, and I serve as the assistant to the president and the director of the president's office here at the college. And I am also one of the founding members of the Black at Hostos working group. I'm also joined by my fellow working group members, Professor Christopher Brian Burrell of the Behavioral and Social Sciences Department, and Professor Kathy Taylor, who serves as a professor of the legal studies at Naugatuck Valley Community College, and is also the co-chair for the Center for Racial Dialogue and Communal Transformation in Connecticut. Today, as I mentioned, we welcome you to the third installment of this ongoing spring semester series of the Black at Hostos Town Halls. And the presentations you will see today will focus on a most timely and critical issue, the intersections of race, medicine, and healthcare in the United States. Detailing the country's long and reprehensible history of medical experimentation on Black Americans, the moderators, Associate Director Jewel Jones and Professor Nancy Genova, will discuss the rollout of the COVID-19 vaccine and what it means for historically marginalized communities, such as ours here in the South Bronx. I'd like to now read a poem to all of you that served as our working group's inspiration for today's gathering. I'm a bit nervous to read it, and it is my first time reading poetry in public, so please bear with me. I will be sharing a poem by Langston Hughes. It is called I Too. I too sing America. I am the darker brother. They send me to eat in the kitchen when company comes, but I laugh and eat well and grow strong. Tomorrow I'll be at the table when company comes. Nobody'll dare say to me, eat in the kitchen then. Besides, they'll see how beautiful I am and be ashamed. I too am America. And with that, I would like to turn it over to our president, Dr. Daisy Coco de Filippis, who will be bringing you greetings. President?
This is her chance to mute me, you know that, all right? So here we are. I wanted to say how wonderful it is that we are now at the third presentation, and I look forward to many, many more from this talented group. I wanted to also say thank you, congratulations to the team. You were selected by the CUNY central office to participate, and in fact, I believe it's on the 15th, which is tomorrow, at 1:30 in the diversity conference. And they will talk about precisely how student activism led to this response to create the Black at Hostos, because it was the students asking for us to host the first town hall on Black Lives Matter. And we did that, you know, as soon as I came, we were responsive to that. And we began with that. And it has brought really powerful, powerful discussions. So thank you. I also take this time to congratulate publicly Professor Kathy Taylor, who's being recognized by the United Way of Greater Waterbury for her work as a community advocate and leader. And that she is. You know, I remember recommending her to a couple of committees, and little did I know she was going to chair the board of the Connecticut Community Foundation. You can't let her lose anywhere. She's just fabulous. So thank you, and thank you for joining us. I'm so grateful. So I am being joined today, and I'm very happy to see him, Brian Carter. President Brian Carter of the Student Government Association will bring some remarks. If you have not been following him, he has been writing a weekly column in the Hostos Semanario and the Hostos Weekly. I want to thank him personally for all the women that he recognized in his remarks last week. It's a good thing to remember that women are half of humanity and they give birth to the other half. I remind my three sons of that regularly. So I was very pleased to see your note and the way you recognize your mom for raising four fine children. So I cannot wait to hear your remarks, Senor Carter, President Carter. I know that we are being joined at some point by our representative, Councilman Rafael Salamanca. I'm so pleased every opportunity we've had, and I've met with so many elected officials. I invite him to join us, and I believe he's the third or the fourth to do so individually. And then we had this wonderful team of women elected officials a couple of weeks ago for Women's History Month as well. So we welcome his support. We thank him whenever he's able to. Oh, there he is. There he is, Councilman Salamanca. So good to see you. Thank
Hey,
you
how
for
are you?
joining us. I'm so happy to see you, sir.
Yes.
And I would like to give a special thank you to Professor Nancy Genova and to Associate Director Jewel Jones for the wonderful moderation of this event this afternoon. I want to tell you that when I saw that title, the first thing that came to mind was Langston Hughes to me. I am so pleased that Director Kramer got to read it. I also want to bring out that, you know, as always, this Black movement, thank God for that. I remember writing my early pieces as a young academic saying how much I had learned about racial identity from Black women feminists and the Chicana movement that was the first really to come up with many articles at that time. I'm talking late 70s, early 80s. That sort of shaped my thinking as I wrote about race and I wrote about identity in Dominican literature and the literature of the Dominican diaspora. So there is a book by Deepa Liar that was published in 2017 that is called We Too Sing America. And it is our brothers and sisters from South Asia, the Arab countries, the Sikh immigrants, and many others who have found in the voice of Black writers, leaders to follow as they struggle for their own American dream. The fact that the poem says, they'll see how beautiful I am and be ashamed. It's the thing is, I too am America. We're still, unfortunately, in some areas, struggling for that recognition for all people of color. And so this conversation around medicine and around our communities, I want to say this again, and I heard an elected official say this, and it made a lot of sense to me, because our communities of color are so much more impacted by the COVID. And because now it is at the point that is not just the elderly, but it's young people in the prime of their lives that are being impacted. I urge our students, our faculty, our staff who are above 16 years of age to vaccinate. My granddaughter, the oldest one, sent me a note proudly that she has her appointment tomorrow. And I received both of my Modernas, and so did most of us. So please be encouraged, and thank you, everyone. I am going to mute myself. Probably I am going to, at some point, if you want to focus on the speaker or on the presentation, also go and stop the video. But I'm here for every minute. I am here, and don't be surprised if you hear me jump in. So I look forward to hearing everyone, and I'll let the moderator continue. Adelante.
Thank you so much, President. And I know we are all continued to be inspired by poetry, especially during this National Poetry Month that continues through the month of April. So I'd now like to introduce our next speaker, who is SGA President, the Student Government Association President, Mr. Brian Carter, who is a radiologic technology major and is also joined here by a good number of our own students. So thank you so much, students, for continuing to show up to these events that you have asked for. So President Carter, if you would.
Thank you. Thank you. Hello, everyone. Good afternoon. Hello to all students, faculty, and staff as well of Hostos Community College. As we gather here today under the circumstances, I am here to continue to uplift the spirits of our beloved community of Hostos, which has been under much added duress during the most significant and challenging semesters that we all could ever imagine. Throughout the calendar year, I have continued to impact our student body with information in the form of positivity, which involved the Counseling Center and various workshops to keep our students engaged, such as our current series entitled Let's Talk About It with Tova Thompson and Michael Martinez, to give the students some sense of normalcy. How is racism bad for our bodies? Well, the social detriments of health are the conditions of which people work, learn, age, play, and worship. Health disparities are avoidable differences between the health status of different groups. A health difference is that is closely linked with social, economic, or environmental disadvantage. Health disparities adversely affect people who have systematically experienced greater obstacles to health based on their racial or ethnic group, religion, social economic status, gender, age, mental health, cognitive, sensory, or physical disability, sexual orientation, or gender. Black women's risk of breast cancer is generally dismissed as being lower than white women's. The lower risk is overshadowed by Black women's higher risk of dying from it. 86% of white women with breast cancer are alive 5 years later. Only 71% of Black women survive that. Black men have the nation's highest rates of developing and dying from prostate and lung cancers. Heart disease claims 50% more African Americans than whites, and African Americans die from heart attacks at a higher rate than whites. 49% of HIV infected Americans are African Americans. 86% of children with AIDS are African Americans or Hispanics. Black women suffer the highest rates of stress and major depression in the nation. Suicide rates climbed 200% among young Black men in the last 20 years. And that led me to start a workshop series based, this is an extension of our previous series entitled Candid Conversations, which are held in a safe space workshop and environment, highlighting sex and respect, address several topics, including sexual hygiene and protection, communication, consent, societal norms, and issues and sexual relationships. We have been providing a safe space to open the conversation for dialogue for the female and male perspective on these ongoing interesting topics of discussion, which are held every Tuesday from 3 p.m. to 4:30 p.m. Because of the current climate, we will be including a series of additional workshops with necessary discussions about racism, which unfortunately, as you have all witnessed in the latest casualty of color, Dante Wright. We will have discussion on several viewpoints highlighting an additional forum, which will allow students an opportunity to vent in a safe space environment provided by the Counseling Center, which we gladly appreciate continuing to provide us this platform in the form of love, opposite of the agenda that promotes hate. How many more have to be made an example of? Do you really see color, or are they just really culturally blind? How do you feel intimidated by the mere sight of my people that forces you to act on impulse, improving a violent act? Why must we continue to feel like the hunted in this world of predators? These constant questions are continually segued into internal excuses that must be addressed even within our own race. When money is involved, some people's common sense can be bought financially. Integrity is not an option. It is not a choice on the stock market. Therefore, a person of color is definitely the most significant outfit that we will continue to wear with pride. Hold your head up, my people. We will continue to rise no matter what the agenda might be, considering its best. For there will be clearer days amidst the haze. 2020 is a vision of perfection, but Black excellence is the standard and no longer an option. And with that being said, we can continue on.
Thank you for those words, President Carter. May everyone here heed them and join you in one of those activities presented in partnership with the Counseling Center, and for all of the good that they continue to do through the ongoing pandemic, virtually for our students and for our staff and faculty. Thank you so much. I now have the distinct pleasure of welcoming Rafael Salamanca Jr., who serves as the council member for our district, the 17th district, and he represents the South Bronx. He also serves as the chair of the Land Use Committee, and I'd like to tell you a little bit about him before I turn over the microphone. Rafael Salamanca Jr. is the son of first-generation Puerto Rican immigrants, and he grew up in the Bronx and understands the value of hard work and the importance of giving back to the community. He began his career working in healthcare to expand access for low-income and working families, where he then went on to serve as the district manager for the Bronx Community Board #2 for nearly 6 years. He has also worked closely with the New York Police Department and other local leaders to help improve public safety in the community. Since his special election in 2016, he has continued to be a champion for affordable housing in our area and has brought thousands of affordable units to his district and focuses on ensuring residents of all incomes have access to new apartments. With that, I would like to introduce our councilman, Mr. Rafael Salamanca Jr.
So good afternoon, everyone. I'm Rafael Salamanca. I'm the council member for the area. My apologies. I'm in the middle of I'm running around today, and I'm in the middle of a meeting. So I stepped outside so that I can just greet you briefly, and then so please excuse the noise. You may hear Mr. Softy. Mr. Softy is, riding around in the area. I want to thank your new president, Ms. Daisy Phillips, for inviting me. I'm a big fan of Hostos. I did not attend Hostos Community College, but I understand the value of what Hostos provides for our communities, especially individuals of color. I've been the council member for the last 5.5 years, and I can tell you, I didn't come from a political family. I basically worked my way up in the healthcare field, but I always had this niche for being involved in community service. And the way I got into politics was that I joined my local community board, which if you guys don't know about your community boards, I encourage you to get involved. It's what's called the first level of government. You can all apply, and you'll get appointed by either your borough president or your city council member, and you have real power there. And as a member of the community board in 2007, I learned the value of the power that local community boards have, whether it's about approving liquor licenses or approving projects that need city funding or need city approval, that need community approval. That was a great opportunity for me. And it was then that I realized that my calling was government and getting involved in community service. And so there was a vacancy to become the district manager for that community board. I applied with 20 other people, and I was able to convince my community board that I was the best candidate. And I really enjoyed that opportunity. One of the greatest honors was to be able to serve a community that I was born and raised in, and serve in the capacity to bring positive change. And it's not really big change at times. I was able to bring stop signs where they needed them. I was able to address potholes where they needed to be addressed. But that hard work caught the attention of the elected leaders in my community. And so when there was a vacancy for my council seat, I approached them and said, hey, I have an interest. And they coalesced around me, and I got their support. And so if this young kid from the South Bronx with just an associate's degree can do this, and right now I am the chair of the Land Use Committee, which is the most powerful committee in the city of New York, I think anyone in the South Bronx or any kid, whether you're Black, Hispanic, anyone that's minority can do it. So I just wanted to say hi. Just to tell you that I'm a strong supporter of the work that you guys do there. And I'm looking forward to the day that we can have these in-class meetings where I can physically sit there and take questions from you guys. So again, thank you again for the opportunity, for allowing me to speak. I was looking at the itinerary. I know that you guys today are going to be talking about the conversation today is about Black Lives Matter. And I'm reading here a conversation about how individuals are skeptical about the COVID-19 vaccines. And especially with the news that we got recently about the Johnson & Johnson, right? And how it's creating, some individuals are getting an adverse reaction in terms of blood clots. And I'm concerned, I can tell you that right now, because I got my Johnson & Johnson about 4 weeks ago, and so did my wife. And so, you know, the adverse reactions, I have not felt any of them, but it's a great concern. And I have, believe it or not, have a 21-year-old stepson, and we had an intense conversation this weekend about the vaccine. I was trying to convince him why it's important for him to take the vaccine so that he can protect myself, my wife, and my family. And honestly, you know, he had a very valid reason, even though it was an intense conversation. He says, Ralph, why do I want to get the vaccine if after I take the vaccine, I have to wear a mask? Like, it just doesn't make sense. And so I can understand, you know, the concern and the skepticism throughout why do we need to take the vaccine, and knowing the history of decades ago, how they experimented on people of color, especially the Black community. I can totally understand that. But with that, I'm going to allow you guys to have that conversation. My office is on Southern Boulevard in Westchester. And just so you know, on the record, every Thursday from 9 to 5 on Southern Boulevard in Westchester in my office, we're doing COVID testing free of charge. So if anyone wants to get tested for COVID, feel free to come to my office to do that. And also every Thursday, the city of New York has health and hospitals are in my office, and they are making appointments for individuals that are interested in getting their COVID-19 vaccine. Because we know that in communities of color, especially my community, individuals that are interested in getting the COVID-19 vaccine, it's been difficult to navigate the system. And so we're just making it that much easier for everyone. So with that, I think I've spoken too much. God bless you, que Dios lo bendiga, and thank you again for the opportunity to address you.
Thank you so much, Councilman. We are so grateful for your time, and with your permission, we'd like to release this information on your office's COVID testing to our community. We do have a weekly bulletin that the president prepares from her desk, and so it would be great if we can share that information with the Hostos family.
That would be awesome, please. I'm here to serve you. Thank you.
Thank you so much.
Okay.
Thank you. And so now I'd like us to continue and introduce our first presenter, Ms. Jewel Jones. Ms. Jewel Jones serves as the Associate Director for the Office of Compliance and Diversity, and she is also the Deputy Chief Diversity Officer. Ms. Jones, if you would.
Thank you. Thank you, Diana, for such a great welcoming. I have to say that what our council member just discussed is just basically an excellent segue into this discussion today. He spoke about the hesitancy of those in terms of the vaccine. He kind of talked about why for some it's because of experimentation. So that was like just an excellent segue into what we're going to be discussing today. So I'm about to share my screen, everyone. Give me one moment. I want to kind of focus on a particular aspect of today's presentation when we talk about from experimentation to participation, and just keep that in mind as we go along here. So basically, when we talk about experimentation, I have 19th century here, but I'm also going to have a timeline to what's happening at present. You might ask, why do I start with the 19th century? And there's a particular reason why I start with that, and I'll get to that. When people hear about experimentation, some things come to mind very, very easily for people. And I'm going to take a kind of a brief look at some of these things that might come to mind for when we talk about experimentation in America. And so let's look at that. A lot of you may have heard of the Tuskegee Experiment, where you had Black men experimented on, and in terms of untreated syphilis. I'm sure many of you heard of that. You may have also heard of an individual called Henrietta Lacks. There's a book out, The Immortal Life of Henrietta Lacks. She was an African-American woman. She had cancer cells, and they're very famous now. They're called the HeLa cell line. They were first immortalized. It was the first immortalized human cell line, and one of the most important cell lines in medical research. Why HeLa? The first two letters of her first name and her last name, Henrietta Lacks. And this is very important because this cell line It's an immortalized cell line. It reproduces indefinitely under specific conditions. And the HeLa cell line continues to be a source of invaluable medical data to this present day. So it was very important. Why do I talk about the Tuskegee experiment? Why do I talk about Henrietta Lacks? In both cases, individuals were experimented on without their consent. Without their consent. We all know about the Tuskegee experiments, what happened there. But in terms of Henrietta Lacks, she went to this hospital to receive care. While there, there was this cell. This was taken from her. This cell was taken from her without her consent. As it turns out, it's very important in the HeLa cell line. It's very important, but it was without her consent. So we have to keep these things in mind when we talk about experimentation and the medical community throughout history. Now, I want to kind of talk about I did want to mention this. There's a book called Medical Apartheid, and the author is Harriet Washington. Medical Apartheid talks about the dark history of medical experimentation on Black Americans from colonial times to the present. It's a history of medical experimentation on African Americans. It talks about the different medical experiments that have taken place. And I want to emphasize a couple of things: done to Blacks and without their consent. And it's a very enlightening book. It's eye-opening. I have it myself. I've had it for several years now, and it's a very important book. So beyond talking about Tuskegee, Henrietta Lacks, there have been a lot of marginalized groups that have been experimented on in history. We heard of there's prison populations have been experimented on without their consent. You have to look at these different types of groups that this has happened to. Now, this subject matter, it's not a very pleasant thing to talk about, but it's something that we should talk about, because when we talk about this now, we have to look at it in terms of the present as well. Now, there's a particular individual that I want to spend some time on during this discussion. Let me go back just a moment. So, when I say 19th century to the present, and you wonder why I say the 19th century, there's a particular individual. His name is J. Marion Sims. You may have heard of this individual. He's a celebrated doctor in history in the 1800s. He is known as the father of gynecology. But that's not all he's known for. J. Marion Sims, the father of modern gynecology, performed shocking experiments on enslaved women. Now, what do you think? Why do I talk about this individual? Well, on the one hand, out of these experiments, there are things he did, introduce to the world, these things in terms of, for women out there, there's the speculum. So he's known for these instruments. He's known for surgical techniques. He's known for these things. And these are some pictures of things that out of his experiments, this is what came about. Now, a little bit more about J. Marion Sims. It has been written about Sims. Few doctors have been as lauded and as loathed as James Marion Sims. That's his full name. As I said, he's been credited as the father of modern gynecology. And I'm going to show you some slides in a moment. But he is known for developing these pioneering techniques, in terms of women's reproductive health, in the 1800s. He's celebrated in his field. Holland, as I credit him. In 1876, he was named president of the American Medical Association. In 1880, he became president of the American Gynecological Society, an organization he helped create. That's great, and he pioneered these techniques, and he's done all these things for gynecology, right? What else about Marion Sims? That all being said, please be aware of the dark history of medical experimentation. And in particular, that his research was conducted on Black women without anesthesia, on enslaved Black women without anesthesia. Medical ethicists, historians, and others say that his use of enslaved Black bodies as medical test subjects falls into a long, ethically bereft history that includes, as I mentioned earlier, the Tuskegee syphilis experiment and Henrietta Lacks. Also noted by critics, they say that Sims cared more about the experiments than providing therapeutic treatment, and that he caused untold suffering by operating under the racist notion that Black people did not feel pain. I must repeat that, everyone, because I'm going to say a little bit more about James Marion Sims. But at that time, he and others in the medical field, and I'm going to say to this day, but he believed that Black people did not feel pain. That's incredible to say, and I'm going to say it again, that belief exists to this day, and I'm going to give an example about that a little bit later on in this presentation. This 19th century physician has been celebrated. He's been lauded with dozens of statues around the country. You may have seen these. There's statues, around the country celebrating James Marion Sims. I live in East Harlem. This is the James Marion Sims statue. This appears at 103rd Street and 5th Avenue. This is the James Marion Sims statue. Now, why do I talk about this? I've just said that this statue appears at 103rd and 5th Avenue. I live in East Harlem. This is considered part of, this is East Harlem and the backdrop of Central Park. Wait 1 second. Now, why do I talk about this individual? Because I live in this area, but I'm, besides being a Hostos staff member, I have a lot of interests in my life. I'm very, very busy. I do a lot of things outside of work. I'm actually part of an academy. Okay, I'll talk more about that in a moment. It says CRA, but it stands for a Community Research Academy. Okay, now the photos below I'm going to show you in a moment were taken last month. I left my apartment. I walked a couple of blocks to Central Park and East 103rd Street, and it's a photo of what's there now, and I'll get to that in a moment. It's a photo. There's a photo. I took a photo of what remains after the removal in 2018 of the James Marion Sims statue. It stood at 5th Avenue, 103rd Street in East Harlem from 1934 to 2018. It's been there that period of time. Before I go a little bit more into this, I just want to kind of, just for the students out there, this was an assignment I did called a photo voice assignment. You might have done this within your classes, but it's a photo voice assignment. That's where you basically, take a photo of something and then through that photo tells a story for you. And it's a very easy thing to do. You go in your community, something of interest to you. You take a photo, and then from there, sparks discussion. We've heard the expression, one picture is worth 1,000 words. So this is a photo voice assignment I did for this particular academy that I'm a part of, and it's called a Community Research Academy. I will discuss in a moment. Let me go back to what I was talking about. So in 2018, the statue of Dr. James Marion Sims was removed after a decades-long struggle involving, among other entities, Community Board 11. Our council person just talked about his involvement in the community board. I actually was on my community board for many, many, many years, and I was on Community Board 11 in East Harlem for many years, actually. I'm a resident of East Harlem, as I said, a former member of the board, but moreover, I'm an African-American female who's been, I'm going to mention 3 names in particular: Anarcha, Betsy, Lucy. Why do I mention these three women? Anarcha, Betsy, Lucy. Because these are three enslaved women of African descent who were experimented on by Sims during multiple painful surgeries and without anesthesia. So please keep in mind these three women. When we talk about photo voice, you have to give voice to these women. And I must say that one woman, so there were multiple surgeries performed, multiple experiments performed on these women without anesthesia. One woman in particular was Anarcha. It has been written that Sims performed like 30 experiments on her alone. It's unbelievable to imagine. Two surgery, but multiple surgeries. And she in particular, there's 30 experiments performed on her. And again, without anesthesia. I became involved in the struggle some years ago in terms of calling attention to James Marion Sims, to this figure known as James Marion Sims, to the man behind the celebrity, and most importantly, to these three women who were butchered at the hands of Sims. And throughout when I was part of the community board and other activism within East Harlem, I did some research. In my research of Sims and the statue that was placed at 103rd Street in East Harlem, El Barrio, I began to wonder why. Why is this statue in East Harlem? Why do we not know about the horrific experimentation of Anarcha, Betsy, and Lucy? And why should we allow this man to continue to be celebrated here? I believe at the time that I should take a stand against this racist individual, the idea about to celebrate this individual, the systemic racism that exists within the medical community. And I decided to raise my voice, which is what I did. I, along with Community Board 11, the East Harlem Preservation, fellow East Harlem residents, elected officials, other advocates, we all banded together. Now, this was not overnight. I can't remember when I joined Community Board 11, but I was on there for like at least 8, almost 10 years. And even when I began, there was talk about this statue. And there's been talk all this time. So we all banded together to raise this one singular voice against this man. Moreover, for these three women and the countless others who, at the hands of scientific experimentation or scientific research, were among the voiceless. This is what stands. If you walk over to 103rd Street and 5th Avenue, this is what you'll see. This, because the statue has been removed. And there's this little plaque down there. This is what it says. What's happening here? I'm not going to go into this, but please pass by. That is basically 5th Avenue. That's Museum Mile. That's known as Museum Mile. And that's just a pleasant stroll to go from south to north, north to south of 5th Avenue and different museums. But I must add that directly across from the statue is the New York Academy of Medicine. The New York Academy of Medicine. So you wonder maybe perhaps why this statue is there. The New York Academy of Medicine is right there as well. So I'm not going to go into this, but this basically gives information as to what happened, that the statue was removed. It says who were Dr. James Marion Sims, Anarcha, Betsy and Lucy. Why was it removed? What will happen now? So in terms of that, now I mentioned that I'm part of this academy. Now I strive to educate myself to further in terms of further education. That's very important to me. Education is key in our lives, especially as Black and brown folks. So in addition to my many pursuits outside Hostos, I'm currently a student at the Community Research Academy, and it's with Weill Cornell Medical Clinical Transitional Science Center, or CTSC for short. They've developed this Community Research Academy, and the mission of the academy is to introduce community members to the translational research process, which is research that starts in scientific labs and extends to the bedside of the sick. I, as a participant, learned about clinical and translational research process of the process in terms, and we talk about clinical trials, how they all work, and we talk about research. We learn basic research concepts, data entry, many different things, health inequities, etc. So the attached that photo voice was one project that I recently completed. And as I said, my subject was James Marion Sims. And I'll say this part, who will no doubt be discussed during We Too Sing America from Experimentation to Participation, as he conducted horrific experiments on enslaved African-American women without anesthesia and on multiple occasions, among other things. And so I must say this again. Sims was of the belief that Black people do not experience pain the same as whites. And as I said, the statue was there, it's since been removed, and that's a result of advocacy efforts from many in the community. And I like to say that I had a small part in this effort as a member of the community board, as I stated, and as one who, among other things, stood in front of the statue to speak out against this ban. And there was one occasion when I participated. We stood in front of this statue to speak out against this man. Now, I want to just show you this article here, everybody. My name appears in this article. I little vanity here, yes. This was the Uptowner in 2016. The title: East Harlem Activists Still Pushing to Remove Controversial Statue in 2016. Now, I kind of did this. I love using PowerPoint, so I did this article. Put a slide together, but I did leave this little piece slightly visible because basically it talks about what I said, because I'm actually quoted. And what I basically said is this. When there was discussion about this statue, we had individuals from the Parks Department come before the community board to tell us what their options are, what their solutions are in terms of this statue. Should it be removed? Should we perhaps put a plaque at the bottom of the statue to talk a little bit more about this individual, but also to talk about the 3 enslaved Black women that Sims experimented on? So I'm actually quoted as saying, and I'm like, you can't see the whole thing, but I basically said, I'm not okay with placing some small plaque at the foot of this man to talk about these 3 women. It's just like further subjugating these women. You're at the foot of this man with some small piece of whatever. I was not okay with that. So I spoke out at the meeting and said that. So I'm quoted as saying that in this article. So I must say that where do we stand right now? 2018, as I said, and that plaque that I mentioned earlier does indicate what the status of this replacement of the Sims is. So what happens is this: there's actually artists and that will work towards replacing the statue. I will speak about that in a moment. And these artists will strive to construct an art piece, you know what, that's more representative of the community. We're talking about East Harlem, El Barrio. Perhaps there could be something more appropriate placed at that site of 103rd Street and 5th Avenue. And so what's good about this is, the entities that put statues in places or are involved in these things, they're listening to the community. That's very important. Listen to the community. Continue to inform and engage. The community should be informed and engaged. East Harlem, El Barrio, and the community at large are being informed. Community Board 11 is being informed. I am no longer a member of Community Board 11, but I obviously still attend meetings. I live in the community. I'm not a board member, per se. I actually was I rose to the being secretary of Community Board 11 before I left, but I'm still involved. The East Harlem Preservation. Now I mentioned that before. I want to say that they spearheaded this effort in terms of the James Marion Sims statue. It was the East Harlem Preservation. I encourage everyone to look up the East Harlem Preservation. Marina Ortiz is the president of that organization. She's the one that spearheaded this whole effort. And she was a former member of Community Board 11 as well. But New York City Department of Cultural Affairs should be, engaged with them, the Parks Department, and elected officials. We just had our council person. Now, I have to say this. He mentioned, he was on his community board. He became the district manager. My council person is Diana Yala. And when I talk about anything in terms of engagement and advocacy, I will always talk about the community board as well, because I think that is so important for us to be a part of our community boards. It really is the first level of government. It's the community board, city council, etc. It is the first level of government. Getting back to elected officials. So you should know who your elected officials are. You should know who your council persons are, your council persons, who your assembly members are. My assembly member is Robert Rodriguez. And I must say that I know Robert personally because when I was on a community board, when I first became a member of Community Board 11, Robert Rodriguez was the chair of Community Board 11. So he and I go way back, actually. And as a matter of fact, I followed his career, and he is our assemblyman at this point. And also we have Senator Jose Serrano Jr. And the other relevant groups and organizations. So that's where we currently stand. So what's happening? So we've been informed as residents of Harlem that the Department of Cultural Affairs will work towards replacing that statue. So I'm not going to go into this, just for visual. Basically, there have been panels, there have been discussions about what should replace that statue. I also want to just show, and there's a little bit more, and then these are some of the organizations, entities involved, 2111, as I said, pardon me, and others. Now, there was this on October 5th in 2019, there was an actual town hall, and it took place at the Museum of the City of New York. At that town hall, we heard from artists who were in the running to present their art piece as a possible replacement for the James Marion Sims statue. This was a very, very entertaining and very, very informational panel that I went to. They presented what their ideas are in terms of what should be in place of James Marion Sims, and these are the finalists. Now, unfortunately, I have to say, I'm not sure who ultimately prevailed, because this was in 2019, and we all know what happened sometime after that. So this is to be continued. I also want to mention that cultural affairs, many different panelists, many entities were involved. So the replacement of the James Marion Sims statue is to be continued, everyone. I will keep you posted, let you know what happens next. Now, as I
go ahead.
Go ahead. In terms of this little timeline that I mentioned earlier, in terms of this timeline, so we talk about I went back 19th century physician, this James Marion Sims, because the statue appeared where I live. So I was interested, but just we should all be interested in terms of this these racist medical experimentations that have taken place in our history. But let's talk about present day though. From there to present day, and I just want to let me just say this first. And as others before me mentioned, we have COVID-19. We have obviously the pandemic, everyone. We have COVID-19. And we have vaccinations, right? And when we talk about that, we have to kind of talk about participation and how this fits in. But before I do, I want to just say this. I want to show Many of you may have heard about Susan Moore, a Black physician in Indianapolis. She suffered from COVID-19. She was in the hospital. She was suffering from COVID-19. And she's a doctor. She actually had to speak out on her own behalf to say that she was experiencing pain. And she's a doctor. Well, we all know our bodies, but she knows these things. She actually said, so basically, let me just tell you what this says. Her pain was not acknowledged. She actually said, those people were trying to kill me. Let's just take a moment back to James Marion Sims, who felt that Black people did not experience pain, the same as whites. This is 2020. Her peers are telling her, no, you're not in pain. No, her peers are telling her that. I must say that, I have to say, she's struggling with COVID-19 on the one hand, but she's also struggling with this racist system we have on the other. Her focus should have been on getting better in terms of COVID-19, but she was also struggling with this. That's horrible to consider. And unfortunately, she passed away. But I wanted to talk about something more, in terms of what we're talking about in terms of COVID-19 and vaccinations, and in terms of from experimentation to participation. What can you do in terms of, as an advocate, as a civically minded person, in terms of COVID-19 and vaccinations? Yes, I've been vaccinated. I actually received my second Pfizer dose this past Friday at Harlem Hospital. I have my card. I have my second dose. I chose to do that. But we must understand, acknowledge, recognize that there are those who, because of this racist history of experimentation on Black and brown and other marginalized folks, they may have some hesitancy about the vaccine. That's understandable. But if you can, and what you should do is just be informed. You inform yourself about the vaccine, the different type, what's available, Moderna, Pfizer. I'm not going to mention J&J, but inform yourself. As I said, I when I was able to do it, I did it. Because you have to think about beyond yourself and others as well. I'm happy to take questions, and thank you for listening, everybody.
Thank you so much, Ms. Jones. Thank you for that presentation and for bringing us all the way back in history now to the modern day. If anyone has any questions, please put them in the chat to me so that I can read them out as we continue with our second part of the presentation, which was originally prepared by Professor Nancy Jernova. She is a lecturer from the Public Policy and Law Unit. She is unfortunately unable to join us this afternoon, so myself and the co-working group partners here will be presenting her slides. So if you would, Professors Taylor and Burrell, take it away.
Good afternoon, everyone. We are, sad not to have Professor Jernova here in order to present this material herself, because her expertise would certainly have shined through. But we're going to do what we can in order to make sure that the information that she has prepared is able to be shared with the community here. And so I agreed to talk about some of the more historical elements of her presentation because we all felt, and she certainly felt, that it was important to provide a context for the information that she will later provide about health disparities among different groups of color, both in the South Bronx, looking at the New York City context, and in some cases, the national context. And so by way of context, it's really important to talk about a history of racism in the United States, especially with regard to, ideas about race and sort of physical and intellectual attributes. And that one of the ways that this, sort of white supremacist ideology reflected itself is in terms of pseudoscientific ideas of racial theories and racial hierarchies that placed, people of Aryan, sort of Aryan racial background or Northern European racial background as superior in terms of physical attributes, intellect, and morality and character. And along this supposed racial hierarchy, those who were closer to Aryan in terms of their descent were higher on the racial ladder. And at the very bottom of the ladder were supposed to be sub-Saharan African peoples. And the closer one was considered to be of, sub-Saharan African, the lower they were on the racial ladder, the more deficient, the more defective in terms of, intellect, character, and physical endowments. And part of this ideology and the way it manifested itself in policy and the way it carried over into ideas about, as Ms. Jones said in the previous slide, different ideas about, Black people not feeling pain to the same extent as white people, or their bodies being more disposable than those of whites, is that it contributed to a long history of medical experimentation on Black and brown bodies. Not only in the cases of J. Marion Sims, but there are examples historical examples we can point to of Puerto Rican women being subjected to forced sterilizations without their knowledge throughout the first half of the 20th century. Puerto Rican peoples being deliberately killed in medical experiments in trying to find out the effects of treatments that would potentially be related to cancer, other kinds of chemical irritants that would ultimately be used in warfare, such as during World War II. There are examples of African-American women being unknowingly, forcibly sterilized, as in the case of Fannie Lou Hamer, the civil rights activist of the 1960s in Mississippi. And this was a statewide, project that was occurring for decades. It was kind of an open secret in Mississippi that Black women were being sterilized. And of course, just in the last couple of years, it came out that women who were being, immigrant women who were being held in, US facilities were also being sterilized against their will and unbeknownst to them. And until that was brought to light by a Black female nurse who worked in one of these facilities to expose what was happening. So there is this, sort of long and brutal history of experimentation. And we can go back to, Margaret Sanger in the 1920s, who on the one hand is, credited with providing, more information about, birth control and trying to sort of normalize, the idea that women should have control over the sizes of their families and their sort of, reproductive choices. But on the other hand, sort of also, bought into ideas of eugenics, that people, that certain groups had certain characteristics that could be sort of kind of removed from society if we could control who could reproduce and how people could reproduce, and believed in the ideas, associated with population control, that, part of the reason why poor families and immigrant families were so large, that this was something that the government needed to step in and control, right? So there is this, sort of important history that needs to be complicated around issues of health and experimentation and reproduction, right? And what that means, and especially in racial terms when we talk about policies. So I guess if we could move to the next slide. I'll say a little bit, one of the things that Professor Genova wanted to do was to connect this past history to the present day, and to show how that earlier history of experimentation connects to health disparities that continue to persist in communities of color, not just related to COVID-19, which she also talks about in the presentation, but across almost any type of, chronic condition, chronic medical condition that one could find. And as we can see here, when you look at, Black and Hispanic, as well as in many cases, Asian Americans outcomes, more people of color report having asthma, being told that they have diabetes, being told that they have had a heart attack or have heart disease. These outcomes are larger in communities of color compared to white communities. I am assuming that these are national figures as opposed to local ones because they're not noted here. But there's all of these disparities. We see it, one of the, in terms of chronic conditions, she wanted to compare, HIV as an example to see how much more prevalent new HIV diagnoses were in Black and Latino communities compared to, white communities. This is still another, epidemic that is ravaging communities of color that correlates in some ways to the current COVID-19 pandemic. And so with that, I'll turn the over to Professor Taylor, who will continue the presentation.
Thank you so much for that. One of the things, and I want to piggyback on the last thing that Professor Burrell just said regarding the high rates of HIV infection in the Black and Hispanic community. Because even though we are at pandemic levels, or it is still an epidemic, we no longer hear about it in the same way that we used to hear about it. And I really want you to hold on to that thought, because I'm going to come back to that point. Here, Professor Genova shares some data regarding the groups that are most hesitant regarding the vaccines. We've heard about this. It's been on the news quite a bit. And so when I look at these numbers, we hear quite a bit about the Black hesitancy rate. And the important thing to remember as well when we look at this data is that sometimes people fit in more than one category because we have multiple identities. So that whole concept of intersectionality. So we can be, I would fit in the age 30 to 49, Black, kind of urban resident, a household with someone who has a serious health condition. I can fit into multiple areas, and yet we can still see this hesitancy by different groups, and what that can mean as we move forward, hopefully into more of a recovery. On the next slide, it begins to talk about Black adults are the most likely to wait and see. Okay, this wait and see approach. Not immediately registering for the vaccine, maybe waiting to see what's happening with friends and family, waiting to talk with doctors. On that very next slide, as we specifically from these 41 states, and I'm guessing that Professor Genova would mention that not all states are reporting the same data the same way. And so when she specifically listed the 41 states, we can see something happening at least across that section of the country. And so one of the things that we know from this data, without knowing what's going on in those other states, that the vaccination rate for white people is 1.8 times higher for Hispanic and 1.6 higher for Black people. Now, that is concerning, particularly in light of the high disparities and the disproportionate impact of COVID-19 on communities of color. Professor Burrell specifically spoke about asthma and heart disease and being diagnosed with high blood pressure or diabetes, and those are all risk factors for serious illness in COVID. And so we have multiple things interacting. And so when we compile that the vaccination rate is not as high in the Black and brown community, we can certainly anticipate that this disparate impact may continue. And that is very problematic. So here you see it broken down more recently, where it's just 1 week ago, just a little over a week ago, where we can see the percent of the total population and how it breaks down along racial lines. And when we think about segregated communities and how we may have Black and Hispanics living together, and we've heard about the number to get to herd immunity. Well, we're the furthest from that group to get to herd immunity because we're the furthest down in the list. And so this too speaks to the disparate impact on our community, not only of the disease, but now in the rollout. And so all of this is not just about hesitancy, although we know that there is some hesitancy out there. Some of it has to do with the rollout as well. And so there's a lot of community effort. And to go to Mrs. Jones' point earlier regarding the engagement. And so in Philadelphia, where I'm from, we have the Black Doctors Consortium that are actively engaged in making sure that there are vaccine clinics in Black communities. And so it is a two-part, both a hesitancy, but also making sure that access and availability is there for all populations, particularly. Here, when we look at this slide and think about these lower income communities and having the highest number of deaths, and it would be really interesting to see how this overlays with the racial makeup in those communities. So we specifically have the poverty rate, And we don't necessarily know what would be the racial makeup of those communities. But if there was any type of overlay, again, now we can have poverty and race intersecting to bring about even more disparate impact for the Black community. On the very next slide, where we see those top risk factors. Now, if we're thinking about just in New York City and it's just per 100,000 residents, lower income, we see the risk factor. Age, again, being born in Latin America. If we're more densely populated, living in a space that has more people, and then being African American. And once again, we can see how we can be in multiple groups at one time. The New York Times did a wonderful survey around April of 2020. And it was specifically looking at New York, because when the country started to shut down March 13th of last year, the focus was really in New York City. And so the New York Times partnered with Google and the telephone companies to see how quickly some parts of the city went to social distancing and staying home. And that was greatly correlated with income. So some people were able to work from home, immediately work from home, social distance, stay home, and other communities were not. And those other communities that were not were exposed for a much longer period of time. And so that's another risk factor in terms of what type of work do we often do that may put us at a higher risk as well. On that next slide here, we can see across the board that adults are being impacted greatly in terms of losing employment across the board here. And so there is not that much disparity between what is happening in the country versus what is happening in New York City. But you can certainly see here that there's a gap. And New York, in terms of Asian, Latinx, and white, and all adults in New York are losing employment at higher rates than across the rest of the country. On that next slide, this is the one where I was probably hoping to hear Professor Genova the most, because I wanted to hear her take on when she saw this phrase on a t-shirt. And so I'm left to envision what I think she would say. So I can only tell you what I get from it. And if I'm thinking about this quote, if money is power, then poverty is silence. And one of the cautionary tales is that we cannot allow our social economic status to render us silent. It's been a call that has been raised throughout the afternoon, speaking about advocacy and making sure that we are at the table and making sure that we are not invisible. And so that's what I see here, because silence represents not having a voice, and not having a voice can render someone invisible. On that next slide, we have some more data regarding the hospitalization and death rates, specifically in New York, and then looking at it quite clearly, we have huge increases in the Bronx when we're talking about either deaths or hospitalizations. And this is one thing that we have to remember, that this has to serve as an alert for us, because our whole mission really in putting together the Black at Hostos series is to make sure that we are talking about how Black lives matter. And so if we're talking about from experimentation, when many felt that Black lives did not matter, were not worthy, if we're talking about getting the vaccine now, one of the things that concerns me probably the most, and President Brian Carter, as he was speaking and giving his notes, I was writing things down because he said, "Clearer days among the haze." And I immediately liked that phrase because there's a lot of haze out there. It's a lot of hesitancy. It's a lot of false information. It is a lot of fear. It is a lot of keeping Black people on the sidelines because of the history. And it is important to acknowledge that history, remember that history, fight against that history. And yet at the same time, we are at a point, just as Langston Hughes spoke of in his poem, I Too Sing America, that dinner is being served, and that dinner could be the vaccine. And I would argue that we have to make sure that we have a seat at the table, because we certainly do not want to be in a position where the pandemic is no longer in the news, but we are still being hospitalized and we are still dying at disproportionate rates. And with that, Diana Kramer will bring us home.
Thank you, Professor Taylor. With that in mind, I do really sincerely hope that COVID would not become the new HIV epidemic in terms of its effects on the Black community. I'd also like to add, in response to your mention of the New York Times phone survey, that was probably the only time a New Yorker was able to not only be interested in answering the phone, but they actually, at that time I recall reading, stayed on the phone longer. And they talked about their bouts of depression during COVID. They talked about their loneliness and how hard it was to stay in a small apartment alone. So I thank you for bringing that up. I do recall that fondly. I'd like to share now a few slides that Professor Genova prepared as a means of offering solutions. And so when she tried to talk about what could be done to help reduce the healthcare disparities for these communities, she really strongly promoted the efforts of hiring a diverse workforce. And what she really wanted us to focus on were healthcare professions in particular. So when we talk about hiring nurses, X-ray, doctors, physicians, she really wanted to have not only access and quality care for minority patients, but also for those healthcare professionals to come from a training that they could not only relate to, but also be prepared for. And this slide in particular really just touches on that and the work done by the Sullivan Commission. She also wanted to talk a little bit about the Patient Care Affordable Act, which is frequently known as the Obamacare Act. And she talked about they had funding assigned for the Centers of Excellence program, which had developed opportunities for minority applicants. And they were specifically meant to train, recruit, and offer them support throughout their throughout a healthcare career program, where they could then become professionals in the healthcare field and have the proper mentorship and networking to better prepare them for that future. At Hostos also, as you know, we do serve underrepresented student populations, both on our non-credit side of the house and also for credit in our degree programs. And we do have a number of offerings where we can not only train and prepare these students for these jobs, but we can also help navigate them to the careers that exist after they graduate. So we encourage you to go look at our website, to reach out to continuing education and workforce development, to really access the existing offerings so that we can all together really try to break down and eradicate these disparities, because we are slowly building the engines for change, and the foundation is already there. Professor Genova also pulled up this information from the US News report on 2014 best jobs rankings, and how they really did stress allied health. And the Department of Labor also, for many years now, annually has been reporting a growth in healthcare personnel. And this will continue, of course, because of the pandemic, I'm sure, to grow, just because there are many jobs that are needed to support the needs of individuals, and baby boomers in particular, who will be either hospitalized or in need of some occupational support or attention. She also lists here at the end her resources. And with that, I'd like to stop sharing the screen and thank you all for your time and for listening. And if I may, I'd like to take some of the questions from the audience, which we only have comments at this time. Yes, thank you, Professor Burrell. Let's virtually clap together. And I'm so pleased that we made it through this afternoon. I know it was worrisome when we started earlier, but I thank you all for your patience and for your understanding. Hopefully Professor Genova soon can share some of her words at a later date. But I'm grateful that the team came together to share her good work. One of the comments in the chat that was shared with me privately is from Professor Soto. And he says, people engaged in collective action, short-term and long-term, can counter the power of money. But to have collectivity, we have to think we rather than me. We rather than me. Thank you, Professor. We also have a comment from Professor Benchiveni, and she says, the sessions were very informative and moving. I wish to thank all panelists and the President's Office for facilitating these conversations. Keep them coming. I also want to invite all organizers to share their ideas with me about how to promote anti-racism and racial justice, so I can report to the Black Race and Ethnic Studies Initiative Commission. You all continue to ponder. I will like to thank again Ms. Jones, Professors Taylor, Burrell, of course, our president, Dr. Coco de Filippis, our incredible SGA president, Brian Carter, all of the students, faculty, and staff who continue to support us. You are also our engines of change, and we look forward to continuing this good work. Black at Hostos doesn't end here. We look forward to bringing you a slew of information and activities for the next semester and through the future, because this is an important cause to continue supporting and to continue growing. All right, with that, I'd like to formally close. I thank you again and wish everyone a blessed afternoon and evening. Thank you so much.